big donors. We actually have donors that are $5 a month, and I have donors that are $100 a month for this organization. We are regional, Western Wisconsin. We are able to take on issues addressed by our care that our members care about. We have a steering committee made up of our own members, 15-person steering committee. We have a health team, which Dawn over there is leading, which has put this on.
I would love to have you get involved in our mailing list.
Yeah, we have an public education team. We have an environmental team, which is very much involved, by the way, in the CAFO situation in Western Wisconsin. We have I want to say, economic justice team, which we're very much involved with living wage ordinances that are being passed around Western Wisconsin. What am I missing? I'm missing
Judicial
one.
fairness.
What did I say?
Judicial fairness.
Judicial fairness, but overall, that would be our social justice, judicial fairness. So if you're interested, I'll give you my card. But I didn't really come here to make a pitch for citizen action. We're here today because of what is happening in D.C. and in this country is vitally important, and you need to be able to have your questions answered.
I have his card.
Okay. And be sure you have questions to ask, right? So you can hear what you have to say in your opinion about what's going on.
Up for a little bit, but then if it's okay, I prefer to sit down so I can take some notes while people are talking. My name is Tom Petri, as Jeff said. I'm the Senator's Wisconsin Legislative Director. That's my official title. I worked for him, or I have worked for him for most of his time in office. I started with him in his Milwaukee office and then went out to D.C. and worked in his legislative office for most of the first term. Came back at the end of last summer, and then when he won re-election, I went back to being one of his state employees, and my new title is as a Wisconsin Legislative Director, and that allows me to represent him, among other responsibilities. It allows me to represent him in setting this when he can't make it. He's out in D.C. or otherwise scheduling conflict allows him not to be at an event. I don't do many large-scale events because most of the time they turn out to be relatively smaller conference room type conversations, but I'm comfortable here if you guys are comfortable here, so that's great. Another thing I wanted to mention is, as Jeff alluded to, the Senator has been unable to take, as many of you already know and feel strongly about, has been unable to take a lot of events that are scheduled specifically at a certain time and a certain date and a certain place. And when scheduling requests come in to the office through the website or through phone calls or snail mail, oftentimes they go through the state scheduler and then they come to me. And I've been able to take at least maybe 10, 15 meetings with groups that are largely opposed to what the Republicans are out trying to do in Washington. Again, this is the largest group, so I'm happy to see that this is one that I can talk to as many people on his behalf as possible. But one other note. Him and I don't talk every day. Him and I don't even talk every other day. And so a lot of my knowledge about his stances on the healthcare issue in general, and I suspect that most of the conversation tonight will be on the healthcare bills. A lot of my comments tonight on his behalf are based on my having worked for him for 6.5 years, and my knowledge of where his brain is, where his heart is, things he said. Obviously, if you guys follow what he says publicly, he has not been afraid to answer a reporter's question. He's not been afraid to give his opinion on this issue, and others, of course, but on this one particularly. So if you've been following either through social media or through just the general news, you know kind of how he feels. But if you want to get a little deeper, that's hopefully where I can answer some of those questions. And I've asked Jeff to either call on people or make sure that if somebody asks me a question and I try to answer it, we don't get the same question 3 or 4 or 5 times. I would love personally, and one of the things that I know the Senator has asked me to do when I do meet with people, no matter the size, is gain perspective on their individual situations. If it involves either Medicaid or gaining insurance on the individual market, or just your general feeling from an individual perspective or from a family perspective. That's part of his information gathering that matters so much to him. if people are just asking questions of him or tonight of me, sometimes we fail to realize how it affects you personally. We don't get that information. So for those of you who maybe don't want to ask a question, but just want to share with me what's going on in your life, that's where I'm going to take a lot of the notes, if that's okay. So, and then afterwards, I'm probably going to hit the road. I live down in Madison, so I won't stick around for too long. I'll let you decide when we're done. Anybody who has a follow-up question can get a hold of me through Jeff or through Steve, who's in the back. I saw Steve somewhere. Over there, Steve was over there. He's the gentleman who invited me up. He's the one who sent in the request through our state scheduler, and I worked with him to be here tonight because I know there was some sort of a public event a week or two ago that he was unable to go to, that you invited him to. So this is what came of that. All right, thank you.
Thank you, thank you. And I want to thank Steve, by the way, give Steve some credit here for being persistent. Fred had his hand up right away, so go ahead, Fred. Can I ask you that you scan so everybody can hear what you have to say?
I will use my outdoor voice. First up, my name is Fred Harding. I'm from the village of Maiden Rock. I want to thank you for coming to hear what we have to say. I appreciate it. It's a potentially daunting position you're in. I understand that. I've got concerns about the polarization of our society, and I believe that the measure of our society is how we take care of our weakest, frailest members. I've got a number of beliefs. I believe in science. I believe in education. I believe in competence and preparation when facing a task. I believe in learning lessons from history. And one of the concerns that I've got is that most of the policies that I'm seeing coming out of Washington, D.C., they're contrary to my beliefs. And that's disturbing. Example, my concern about global warming. When 97% of the scientists say something, how can you with conscience look at that and say, gee, no, I don't believe that man has something to do to impact global warming? I have to say that it appears like the current president has chosen people who are not trying to further their organizations that they're in charge of. Rather, the impression I have in listening to, for example, Mrs. DeVos in her hearing, that she has no idea what she's doing in her department. And that bothers me. What bothers me further is that I read documents that say that, gee, the Democratic Party is obstructing this. Now, I'm a little confused because it's my understanding that the Republicans hold not only the House, but the Senate, and also the President's office. How is that obstruction occurring when you folks aren't even listening? So, at the end of the day, when we hear Mr. Trump say, look at the obstruction, all of the positions that aren't being filled, is it because the Democrats are obstructing it? Or is it because Mr. Trump hasn't gotten organized, remember my point earlier, to actually put forth names? I think this is not a good way to run a government. And so, finally, I guess what I want to say is, if we ask about the lessons that we can learn from history, I would say let's go down to Kansas. Let's take a look at what trickle-down economics did for that state. Not decades ago, sir. I'm talking in the past 5 to 6 years. It's not been good. I think that we need to take a look at that, and I think Senator Johnson needs to break from the lock of the Republican Party, and he needs to stand up and say, you know what? I'm going to stand up, as he strongly did in the New York Times with his editorial, and say, you know what? A lot of the policies here are not helping my constituents. My message to you, sir, is we're paying attention, and the issues that I bring, I can assure you, everyone else in the room will also be talking about similar things. Thank you for your time.
And I should have probably given a little 2 or 3 minutes if you can, and get right to your point, and so a lot of people can speak tonight. Young man right there standing up there.
Well, I'm Leonard Ellison, better known as Toby Ellison, and my background is I was a hospice chaplain for 22 years, worked in healthcare. My main concern is message I want you to take back to Senator Johnson is in regard to the Senate's healthcare bill. I'm going to make several points. The main points I'm going to make are on the Medicaid concerns that I have. First of all, there was an article in the Dunn County News of July 16th by Dr. Navasaria, and he stated in that article that 400,000 children in Wisconsin are covered by Medicaid, and they can be threatened by the loss of coverage with this Senate bill. Also, obviously, children with disabilities and other special needs could also be threatened by this Senate bill. And finally, in regard to the younger children, the setbacks with Medicaid cuts in regard to the younger generation, that would also affect children's hospitals and the services they provide. So I'm concerned about that. Second, the Medicaid coverage in Wisconsin, and I got these statistics from the Wisconsin Healthcare website. 91, as I read that site, 91,500 individuals received care through Medicaid in 2016, and 15,900 of those individuals received institutionalized care. A reduction in Medicaid funding obviously would dramatically affect the care of our nursing home patients. So I would ask the question, where will they go? What will they do? How will they be cared for? My parents raised and educated 5 children. My mother was a teacher, my father was a small business person, and they paid taxes, worked hard, and lived responsibly. By the time my mother needed assisted living, they had no more resources left. And so they eventually went in, she went to assisted living, then to a nursing home, and after her resources were exhausted. So, if she were alive today, how would she be cared for if these reductions are as severe as they appear to be? Third, I did a survey from a website, the business website LinkedIn, and it found that 48% of the doctors surveyed were in favor of a single payer system as opposed to the system that we presently have. And the explanation for a single payer system, the reason they liked that, were astounding. Medical professionals said that they would accept earning less even if it meant fewer dealings with insurance bureaucracy and more time with patients. Many respondents said their income reduction would be more than mitigated by getting out of the, quote, collection business for insurance companies, which averages 4 hours a week of office time in a physician's office. And finally, the prohibition against charging higher premiums for patients with pre-existing conditions has been critically changed in this bill, as far as I understand it. The Senate bill allows insurance providers to charge exorbitant premiums and copays or exclude coverage altogether. To quote Karen Bizig-Lundberg's article from the Eau Claire Leader of July 16th, and I quote, "Inclusion of coverage for pre-existing conditions is meaningless if the drugs or treatment necessary to manage the condition is not covered, is capped, or can be, they can be charged exorbitant co-pays for the specific treatments of pre-existing conditions. So it's meaningless at that point. So for the above reasons, then I strongly encourage U.S. Senator Ron Johnson to cast a no vote for the U.S. Senate bill's health care bill. And I have a copy of this for you that you can, do you want to just pass that forward, please? Thank you. And thank you.
Hello, thank you for being here. My name is Laura Oliver. I'm a Menomonie resident here. I'm a Stout alumni. I've worked in the apparel design program. I've worked as a technical designer, produce manager at a food co-op. I've worked at 2 universities. I have a small business, and I'm currently working a temporary position in an apparel-based or U.S.-based apparel manufacturing company in St. Paul. My husband jokes that I can't walk down the street without getting offered a job. This manufacturer that I'm working at is doing a lot of things that I'm really excited about, and I'd really like to take the job. But they're a small but growing company, and they can't afford to offer insurance at this time. My husband and I have also started talking about expanding our family. So pregnancy and newborn care are conversations that we're also having. And about a year ago, I herniated a disc in my back and had to have back surgery as my left foot and left leg went numb. So my question for the senator is, how does the senator believe that this bill will help that the health care bill will help entrepreneurs and people looking to be part of small American-based manufacturing like myself, but have reached the point in their life where I have a pre-existing condition, because life is a pre-existing condition. And I would, in addition to that, I would urge the senator to vote no.
My name is Nick Novak. I'm a storekeeper in Eau Claire, Wisconsin. I have a short statement for context and 4 short questions. Mr. Johnson keeps talking about getting government out of health care. He says the free market will fix what is broken. I would like to know if he has a model in mind. Can he or you, Mr. Petri, please name one country that provides market-based health care for all, health care, not insurance, that is both affordable to the many and not just the few? 3 other short questions.
No, I can't. I think you knew the answer, but no, I can't.
It's always good to know the answers before you ask the question.
3 other short questions. How does Mr. Johnson like his personal health care? Related to it, what does he pay for it, and what do we, the taxpayers, pay for it?
He is offered insurance by way of being a United States Senator, but he doesn't receive it. He buys individual plan on the individual market himself. So he chooses to do that on his own. He could get it through the plan that, or at least through the same way that I and all the rest of the health or the congressional staff get it. I don't know how he likes it. I don't know how much he pays for it, but that's how he gets it. And that's, I think, been the case.
But he is fully covered because he can afford it, right?
Yeah, he can afford the health insurance that he has.
There you go. Yeah, right.
Thank you for being here, and if you could please pass this letter forward, I would also like it delivered to the senator.
My name is Danielle Johnson. I'm a veterinarian and business owner in Baldwin, Wisconsin. The gist of my question is, what was so great about 2008 before Obamacare? I'm a person who lost my insurance because of Obamacare. I was a member of an association of veterinarians, and that's how I got my insurance. That was basically, it was extremely expensive. I experienced regularly 10% increases, sometimes 15% increases. It went up and up and up. I had to keep electing higher deductible plans so that I could afford it for my family. I thought about getting individual insurance that would be cheaper, but I was worried because I could get kicked off if I got sick. So I stuck with this very, very expensive plan until Obamacare came, and I lost my insurance because it was no longer covered for them. Due to that type of group was no longer covered over with Obamacare. I was pretty much good riddance. Now I actually have some choices. I can get into individual insurance, and as things turned out, long story short, I'm a business person. Luckily this year I was able to provide insurance, group insurance for my employees. It was a great privilege and an honor for me to be able to do that right now. But where is this choice? There's never been a choice. I didn't have a choice before 2008. I don't really have a choice now. There really is, where is the short-term memory loss when it comes to how much premiums were going up before Obamacare? It's never been because of Obamacare. And what was so great about 2008?
I'm retired, and I have three concerns, quick ones. I'm concerned about voter suppression, gerrymandering, and the government asking the states for registration rules. Before I left tonight, I saw on the news that Ron Johnson was starting to go against maybe voting for this bill. And I know you said you don't talk to him every day, but you've kind of been in his head for 6 years. So
my job, yeah.
Why do you think he might be going against it?
Against healthcare?
Yes.
Yeah.
Well, he is extremely concerned that the Medicaid program changes that are inside the current Senate bill. Again, the Senate bill that potentially we were going to vote on this week, and now it's not going to be for another week or two at the earliest. Those Medicaid changes all happen in out years, 5, 6, 7 years from now. The financing program changes.
Exactly.
And he's concerned that that there could be, at least in the mind of some of the Senate majority leaders, the people that are scheduling the bill, that largely wrote the bill, that it could be a little bit of a bait and switch in that they are making Medicaid changes in the bill in order to come up with revenue to pay for other things, the subsidies and the cost sharing reductions for the insurance companies, but that their mindset, again, who knows what's going to happen in future Congresses, but their mindset is that those programs changes that the senator supports will never come to fruition, will never take place, because they are 5, 6, 7 years out in the future. So he is thinking maybe, that's the bill in and of itself. A lot of the changes that are included in it, they're not next day changes, they're not 90-day changes, they're not even a year from now, 2 years from now. Some of them wouldn't even happen until after the next presidential election.
So in other words, would he prefer the Medicaid and all of that got reduced now?
No, he supports doing it in winding down the Medicaid expansion, having it take a couple of years, 3 years, I think the bill is currently. He's just concerned that the current Senate leadership, Mitch McConnell, so on, so forth, that if they're still Senate leaders in 2020 or 2022, 2024, and they have the ability to make those program changes, that they won't, and that's their plan in the dark recesses of their mind. And so that's what I think his concern is. He's concerned. So his goal this week is to find out exactly if that's something that they're actually thinking, and try to get those answers out of them.
Right there, against the wall. Yep.
Thank you. I'm Gretchen Acko. I'm from Menomonie, and I wasn't actually going to talk, but single payer is my thing, and Johnson is a business person, and it seems like a no-brainer as a business person to support single payer, because it would free up all that money from businesses that's going towards their paperwork and their just the processing and the benefits packages that are going towards that. Also, for the economy in general, it'll free up tons of money that people are paying for premiums and to everything involved in healthcare to start buying things that businesses make, thereby increasing. It's a no-brainer to me to do single payer. So my question is, has Johnson even considered it? Has he looked at it at all?
No.
So I
No,
promote
in fact,
reviewing it.
my fan, never will be, never has been. He looks at the VA healthcare system, which is a small little, this is what it might look like if government is in charge of.
It's like Medicare.
He does not support it.
It's like Medicare for all is what it looks like. It doesn't look like the VA.
I actually would like to
Okay, well, about single payer, no, his philosophical backbone is about getting government out of healthcare as much as it's possible to do. And so going in that direction is just the
What about
opposite.
his constituents?
What
about us?
Are we just worthy of dying?
Yes.
Yeah, I'm part anarchist, so don't give me any.
All right, right there, Phil.
Hi, my name's Bill Hogseth, and I am involved with Indivisible Chippewa Valley. We're a group of citizens that are concerned about the state of affairs going on today. And first of all, thank you for coming here to listen to us today. We have been putting a lot of effort as a group into trying to encourage the senator, instead of you, the senator himself, to come and listen to our stories. And again, I thank you for being the one to come here. I know it's, we're not an easy audience, so I appreciate that.
We're all Wisconsinites.
And just to let you know, we have made every effort possible. On April 11th, the senator came to Eau Claire. He was at a private luncheon at the Eau Claire Country Club that was invite only. Because we weren't invited, we sat out in the cold on the sidewalk and asked the senator to hold the town hall. And when he drove by, we were hoping that maybe he would stop and chat, but he didn't even make eye contact.
That's symbolic.
We have written hundreds of letters. On June 19th, one of our members was vacationing in Washington, D.C. and delivered those letters to Mr. Tony Blando.
Yeah, he's our chief of staff.
And we haven't heard a reply. We had a bundle of 100 or more handwritten letters. We've worked with the Eau Claire Community Television to produce videos of our constituents reading letters on camera, requesting the senator hold an open, face-to-face town hall meeting, not a telephone town hall meeting, where the questions are screened, the responses are scripted. We've made phone calls. We hoping that your staff is reviewing letters to the editor in newspapers. We put our requests in through the letters to the editor, and we've still heard no reply. So today, we're sending out a letter to the senator. We're CCing Mr. Blando and MJ Luz.
Yep.
And we're letting you know that we're going to be coming to the Milwaukee office on August 14th, on Monday at 1:30 p.m. in hopes that we can sit down with the senator and have a face-to-face discussion.
What day is that?
It's a Monday.
Okay.
So that letter will be going out in the mail, and we hope to hear a reply. And we think an elected official meeting with constituents is a very basic part of the job description. And again, thank you for being here. It's wonderful to have you here, and we hope you'll let the senator know what we're thinking.
Certainly.
Thank you. Personal Tom back there.
I just want to make a clarification. Thanks for being here, for you to take to Ron Johnson. Government, Medicare is not allowing government into their health care. Medicare is just a form of collection, of payment for your health insurance. You have your own choice of any medical facility you want to go to, any doctor you want to go to. Medicare is a wonderful program. And the reason we need it is because health insurance companies are for profit. Okay? If he did his job and would go back to make health insurance the way it should be 40, 50 years ago, not for profit, they could offer decent policies. Insurance is here for everybody, everybody should be able to afford it. So just one other thing, I don't want to take Lorraine's thunder either, but she wrote an article in the Dunn County News this last weekend about the Physicians for National Health Program. It's a beautiful article, editorial that she wrote. I went to their site as she instructed us to, and they're giving a full list of information there of what a national health insurance single payer like Medicare could do for us. I wish you'd look at me and listen, okay? First of all, employers would be relieved of the burden, okay, of providing health insurance. People would make more money because they'd get a higher paycheck because they wouldn't have to be taking, I think it was $1,900 to $1,000 each month out of their paycheck, okay? Patients would have a choice of doctors and hospitals, just as like Medicare. The government is not in my health care. All they do is collect the money, okay? Less paperwork for providers. Administrative costs are reduced. Other healthcare needs, such as public health, that income inequality, racial inequality, addictions programs could be addressed, and you'd have money for them because you'd be saving money. Better health facilities and planning for them would be more cost effective. Framework for long-term care solutions and mental health would be covered, and you'd have money to spend and do on that. Programs would save billions of government money, yet protect citizens' health care. Right now, when we have to go to private insurance that has no controls on it, okay, what we're buying is insurance that disappears when you need it. Medicare doesn't, okay? And all it would be was a small fraction of a tax on everybody's income that we're already paying now, okay? So Medicare for all, single payer system for the businessman. Why doesn't he think about that, okay? I'm challenging you to take that message to him. That's what we're here for.
Gerrymandering of...
Gerrymandering and just all of the issues that we're torn apart for. How is he showing that he's representing us?
All of us.
Representing the Russian money.
Insurance money.
How is he showing that he's representing?
What about this?
I don't understand. What do you mean by...
And I know I understand that gerrymandering doesn't affect the whole, it affects all these other districts, but.
Is that your question about gerrymandering, or is it about just the larger?
How does he demonstrate that he actually represents all of us and not just his own of the individual philosophies?
Oh, so why is he not a super partisan, somebody who just casts votes on one?
Isn't he?
Yes.
That's what he is.
I don't know about this year. I don't know. They haven't taken many votes this year, to be honest. Other than on the nominee. So,
I'd like to rephrase the question a little bit because it's a good one. Going by the general feeling, the general direction of all the questions you've heard tonight, compared with the senator's direction, are they opposite or are they aligned?
well, they're opposite in those that are bringing up Medicare for all or the single payer issue. I mean, that's not something, he'll listen to, well, no, he's got a strong opinion about global warming. It runs counter to, I'm sure, a lot of you, but there are areas of agreement on healthcare for certain, and maybe even on climate change, and maybe even on gerrymandering and other issues like that. But
well, I'll take just a couple more things since I have the floor. In regards to Medicare, Medicaid, there seems to be a lot of sentiment toward cutting it, which is going to save money for government and in exchange the rich who are paying the taxes. But what's going to be done to reduce the need for Medicaid, to lift people out of the poverty that causes a need for it?
and that's a much larger societal question.
What is the senator? What is his plan to address that? In exchange for taking away the money, how are you going to help people who need it? The other thing is, this plan does a lot to say it's on the surface reducing premiums, but at the same time reducing the the amount of coverage. So there's going to be a lot more out-of-pocket expenses. So really, you're trying to, I don't know, speak like this, but snow people to think, oh, you're going to be saving money, your premiums are going down, so vote for us. But really, in the long run, you're going to be paying more because of all the things that aren't covered. And people don't understand that, oh, I got a cheap policy, lower premiums, but oh boy, if I get sick, look out.
That's right, exactly.
I know there's a lot. I think the young man is right here with the checkered red shirt.
My name is Petri. I'm from Petri, Wisconsin, and thank you for your attention, and thank you for being here. First of all, with a healthcare bill that is being proposed. Thanks, Senator Johnson, for slowing it down because supposedly there's a $57 billion worth of billion cut to Medicaid, and I happen to be on a real nice Irish program, and it allowed me to get the services I need in my own home and community. And I'm concerned about the future because for future generations, education is so important for everybody, and it's so important for them to get in their own homes, because everybody has great potential here. And some people use Medicaid for their job coaches, to get them the benefit of transportation. And my question is if the legislative fiscal bill says that $57 billion cut to Medicare, how are we supposed to get out of care?
Closer to you, and we'll get together, so nice to meet you.
All right, we're all here today. Paul right behind Ramsey there.
If I could have this letter passed up, and then I'll read from it. Thanks for showing up, Matt. There's a lot to cover here tonight. And I'd like to touch on some of the talking points that the Republicans have had as far as introduction of the health care bill. The U.S. has the most expensive health care system in the world, in which 20% of our gross domestic product is consumed by it. Our health care system is based on a for-profit model of health care provision, for-profit pharmaceutical, medical device industry, financed largely in part by for-profit insurance coverage, some of the highest performing stocks on Wall Street. The pharmaceutical and medical device industry spends over $10 billion a year in advertisement. In the last decade, we've seen some of the largest federal cuts to medical research in history. The Republican bill continually calls for cuts or elimination of funding to Planned Parenthood, but nearly 80% of our nation favors keeping Planned Parenthood intact.
Here, here.
The Republican proposals in the health care reform constantly call for drastic cuts in Medicaid, which would critically impact the disabled, working poor, and unemployed. Republicans also continue to propose tax credits to supplement insurance policies for low-income families and individuals. If you can't afford rent, groceries, and clothes, how can you afford to invest into a health insurance policy to qualify for a tax credit? And the same goes for the proposed health savings account. Inadequate or no income leaves the person with the means, does not give the person the means to be able to defer income for a tax savings account. Could you please explain your position on these critical issues? We need some clarity because it's certainly not coming out of the discussion from the Republicans who are writing these bills on Capitol Hill.
I'm truly
There was a question. I'll tackle, where do you want me to start? Which one of those topics did you want me to?
Did the letter get to you?
It's right up there.
It's right there.
Okay. Just pick one item. Senator Johnson vehemently stated that he was opposed to the health care bill because it did nothing to reduce insurance costs. So how does he propose to reduce the cost of the most expensive health care system in the world?
You mean the delivery of care? How expensive?
We have the finest health care system in the world, the finest medical technology. We are consuming 20% of our gross domestic product paying for it. We have a for-profit health care system. How does Senator Johnson propose to change them?
He doesn't have a major plan to change the healthcare system on its own.
These are Senator Johnson's words. He was opposed to the first health care bill that came out because it did nothing to reduce health insurance costs. So what does he mean by that statement?
Well, I think at that point he's talking about the premiums of the people who are getting their plans on the individual market. And the fact that the bill did not contain what he considered enough proof, enough evidence that it would control the rising costs of the health insurance premiums for those that are getting it.
He said health care costs. He didn't specify personal premiums like he just articulated.
The way that we're trying to pass this bill through the budget reconciliation process to allow it to be partisan and only have 50 votes means that the bill's already, as everybody acknowledges, it's already large enough. It's already got a lot of moving parts to it. If you remember back when the House was originally getting ready to introduce their bill, and Speaker Ryan and others in the House Republican leadership were trying to talk about phase 1, phase 2, phase 3. If you remember that back from February, March, and this bill would be phase 1, and then phase 2 would be changes that the administration would do on its own unilaterally, and then phase 3 would be subsequent bills, legislation, that would help with the larger health insurance, health care industry, and that was selling insurance across state lines, and that was probably going to be some pharmaceutical legislation to control the rising cost of drugs. So in this particular bill, it is what it is with the individual insurance market reforms, the Obamacare repair, and then the Medicaid changes. It does not include a whole bunch that would get to the larger nut to crack, which is the rising cost of health care.
Well,
and that frustrates Senator Johnson because that's the bigger change.
I guess the crux of my message is if you take the gross domestic product of the United States, divide it by 5, and then take that number and divide it by every man, woman, and child in the U.S., that's an exorbitant bill to give every person that lives in this country the cost for health care. It's not evenly or equally distributed, and an enormous part of it is going to the profits for the healthcare industry, the insurance companies, and the pharmaceutical industry. And I don't understand why Senator Johnson is saying he wants to lower costs, but nothing that's come out of Capitol Hill is going to impact the profits that these corporations and the healthcare providers are making.
My name is Julie Harper Wiley, and I live in Hudson Township, and I am part of Hudson, Wisconsin Indivisible. I have a suggestion for the Chippewa Valley gentleman who has been trying to reach Senator Johnson. Did he leave? Okay. We registered to attend a Republican fundraiser so that we could see. Okay, why not? It was painful to pay the money, but we did.
Did you stop payment on the check, though?
No, I didn't, but the thought occurred to me.
Good.
Secondly, I echo everyone else here. I'm a nurse, and I'm very concerned about the state of our healthcare system and the lack of compassion that is coming from Washington, D.C. But on a very narrow focus, I am very concerned about voter suppression, in particular for our young people. My latest nursing journal from Madison, Wisconsin had a 4-page article about how our college kids go to school in the state of Wisconsin and they get their student ID card. And they are told that on our myvotewisconsin.gov website and on the voter registration form itself, printed, that they can use their college ID to go to the polls and vote. That's not true. Only 4 four-year universities in the state of Wisconsin have the proper ID for our young people in college to go vote. And Madison is not one of them. Thank goodness for the University of Green Bay. That's one I remember.
You got the Eau Claire too.
Eau Claire. I would like, and I am requesting, Senator Johnson to look into this issue. All we need to do is inform the universities to have the students sign their IDs with a signature, and it has to have an expiration date on it. Then they can use that voter ID, or their college ID, to go vote. We had thousands of young people turned away because then we had to go find the right ID, and that was then got them to the polls too late. So if you could please ask Senator Johnson to look into that issue, I would be eternally grateful.
I'm Deb Monican from Hudson, Wisconsin, North Hudson. And the reason I came in, certainly I'm a retired nurse practitioner, and I have major concerns about the health care. But I think the bigger concern for me right now is in looking over the amount of money from lobbyists that go towards congressionals. Since '98, it has been almost $10 trillion.
Really?
Yes. And to me, we could have paid for everybody's health care. I have been to conferences where they are putting out a lot of money for us just to push a medication or a particular health care program. And unlike what the gentleman said that we have, I know we like to be #1, but we are not #1 in health care. We are #1 in emergency care. And after that, we go way down the tubes. So I would ask that Citizens United be eliminated. I'm asking them to eliminate lobbyists. I am tired of any kind of, when I was working for the government, I was told that I was not allowed to even have more than coffee with somebody, a vendor, or anybody. But as soon as they passed that legislation, they gave themselves an out. And it didn't have to apply to them. So I want this kind of thing eliminated where it's our tax dollars, we want to know how we want to spend it on us. Not on us.
My name's Mary Gerber. I'm a retired nurse. I was a nurse for 38 years, and I echo all of the issues around the health care bill. You know, I appreciate you showing up, but when I called Senator Johnson's office in Washington and talked to one of his aides, and I asked him when his next town hall was going to be, the guy told me he didn't have a schedule. Yeah, okay, but how many town halls, in-person town halls, has Ron Johnson had? That's one question. And number two, what are you going to do with this information when you go back there?
I'll start with saying, I'm going to take the handouts, scan them in, take my notes, type them up, and send them directly to the senator, which is what I do.
I didn't bring a handout.
Oh, well, then I'll take some notes.
And how many town halls, will you answer that question too, please?
Well, it depends on your definition of town hall.
Open town hall. Open, public.
He has not held any physical, where he has come in and the doors have been open and come on, come on. He has held telephone town halls.
He is our elected representative. We are accountable to us. And we are expressing our opinion about a bunch of different things here, and all you can say is that isn't what he believes.
We're mad as hell.
We are not happy. We want him to know that. He represents us. All right, so that's one thing. The other thing I wanted to bring up is that 2 or 3 days ago, the Veterans Affairs Officer guy in Wisconsin reported out that the Federal Department of Veterans Administration is cutting the budget for our homeless vets. Union Grove has 28, and King in Wapaka County has 19. Those places are going to close. These are vets who are homeless, who are disabled, who are suffering from PTSD, and where are they going to go? So much for taking care of our veterans.
Those are the state veterans?
It's federal money.
It's federal money.
The federal money that goes to our state to support those homes is getting cut. And so both of those...
In the upcoming budget or in the current budget? Because we're not done with the upcoming, we haven't even really started.
You asked him. I researched it as much as I could.
I'll find out what's...
I heard the same story.
It was in the newspaper.
The Union Grove, Racine County, and place King in Wapaka County. So that's a total of 47 residents, and both of those places are going to close their doors.
Okay.
Because, as near as I can figure out from my research, the government doesn't think that the government should be supporting these programs.
Well, that's ridiculous.
Really?
I agree. No, I agree with you.
Private companies should be doing these programs. Who else should be supporting our veterans but our government? Seriously.
Then maybe it has, I don't know about that, so I cannot.
Yeah. Well, you better find out.
I'll find the article that was in the paper.
All you have to do is on the internet. And you gotta read more than one article because it's...
Don't go to Fox News.
Hi, my name is Dan Zabrowski. I'm from here in Menomonie. I'd like to change direction a little bit and talk about technology for a second. So the senator has come out against the idea of net neutrality. Now, the idea of net neutrality is that if you pay for the internet, you should get the internet, and that your internet service provider should not be able to decide what content should be slower or faster. Now, all that has to happen for net neutrality to continue is to leave it regulated as a utility under Title II of the 1934 Communications Act. When surveyed, over 75% of Democrats think that leaving it as a utility is a good idea. When surveyed, over 75% of Republicans believe that leaving it as a utility is a good idea. And yet the senator has come out against this.
Our internet.
Yes. Now, the senator has received over $123,000 in donations from AT&T, Comcast, and Verizon.
Really?
I would urge him to re-examine his stance on net neutrality so that it reflects over 75% of his constituents from both sides of the aisle.
Yeah, thanks for coming, Tom. I'm Steve Rasmussen, and I'm chair of the Dunn County Board of Supervisors. Dunn County owns and operates a skilled nursing facility, and proudly, recently, we celebrated 125 years of continued service to our neighbors and our constituents, and here in Dunn County. Back when, in the late 1800s, James Huff Stout was the chair of the building committee for building the Dunn County Asylum. We've changed missions over the years, and today we have a new facility, 3 years old. But I want to talk about Medicaid reimbursement.
Yeah.
And what I'm hearing about the cutting of Medicaid. Medicaid, one of the largest portions of Medicaid goes to fund seniors or skilled nursing facilities. That would be us. Wisconsin already is 49th out of 50 states in Medicaid reimbursement per day per resident. Neighbors of Dunn County has a 67% census of Medicaid recipients. Big portion. Our county board, our county feels that it's our responsibility to take care of our own, take care of our neighbors, our relatives, our friends. Right now, the Medicaid reimbursement at the neighbors funds roughly 2/3 of the cost of care. About $200 a day, and the cost of care is pushing $300. Like I said, we feel that it's our responsibility as a civil society. The construct of government is that we gather together for the common good, and that we take care of them. We have an obligation to each other. These are our neighbors and our kin. Rising cost of health care has caused has caused the cost of this skilled nursing to increase, as well as increasingly complex complex regulations from CMS. Just the whole, as the gentleman said earlier, the cost of health care has risen dramatically. So our neighbors have been farming. They sold the farm. They sold the 30 cows. They've gone into retirement. And then they've fallen on hard times, gone into the nursing home, rapidly spent down their resources, and now their only recourse is through Medicaid. So, what's happened is that we've shifted the cost from the federal government to the local government, to the Dunn County taxpayers. The Dunn County taxpayers.
So who's paying for it? We are.
Yeah, we still
Exactly.
are.
That's
We
right.
paid for it once and then we paid for it again.
Last year, the taxpayers paid roughly $500,000 to support the facility. So it's a shift. And who's getting the benefit on the federal level, Earlier in the legislation, it was that there were tax cuts for the more well-off. You know that. So the question that I wrestle with, how long can this go on? How long can we continue to operate this facility? Do we leave our neighbors or friends or relatives in the ditch? Put them out on an iceberg?
That's what's coming.
I mean, it's extreme, but, you know, that's,
Not fast enough for Johnson.
They want you to sell the facility.
sure. And then what?
And then they'll close after they can't make any money.
So, please,
I will. I've been in contact with the St. Croix County members of, because they're having issues with their skilled nursing facility with Medicaid, and they've requested a waiver they haven't received. And so we're talking to them about how our office can assist them to open it up so they can take Medicaid patients and get that reimbursement.
Thank you.
well, and here's an interesting sideline. If we were to convert one of our 9 houses to assisted living, if one of those people, one of those residents became frail enough that they needed skilled nursing care, they would have to be kicked out of that facility because it's attached to a nursing home. It's a crazy rule. So, except, by the way, do you have a relative that was in government?
No! Is retired postmaster in Green Bay. Retired postmaster.
Well, thank you, Tom,
Right here.
for
He's not
braving
Congressman.
Right next to you, Vic.
Okay.
Thanks, Steve.
I've got a very simple question that other people have alluded to since I've been here. My name is Barb Haupt. I'm a retired disability benefits specialist. I work for the Aging and Disability Resource Center. The most recent Marquette University poll of June 22nd to 25th, 2017 shows that only 27% of the people of Wisconsin favor repealing and replacing Obamacare. 54% surveyed want to keep the ACA in place but make it better. The ABC Washington Post poll of April 25th, 2017 found 61% of respondents in the country want the Affordable Care Act fixed and not repealed. With this information as to what the American people and the people of Wisconsin want, why does Senator Johnson favor repealing Obamacare and replacing it with a health care plan that is more stringent than the one being considered by the Senate at this time? Please explain how he justifies slashing Medicaid for elderly Wisconsinites in their nursing homes and in their own homes, and giving that money to the super wealthy billionaire donors that he kowtows to. That's kind of rhetorical. I don't really expect it.
I was going to try it, but...
There's one back here though, right? Your sunglasses, right? You had your hand up for a while? Yeah.
I have a comparison to make. Blue Cross Blue Shield and what they want is the answer to your question, because that's who he listens to. And what's good for them is obviously what's good for our Johnson. I have an answer to some of these questions in a nutshell, and I'll make it very brief. We're talking about global warming, and we're looking at what's important for us, planet, the plants we eat, every creature that lives and breathes on this earth, or profits for the fossil fuel industry. Which side is Ron on? We're looking for medical care for people, for everybody who needs anything. I just turned 70. When I turned 65, I got Medicare and I got Social Security. It was a contract I entered with our government when I took my first job at 16.
That's right.
When I hit that age, it was there. That's your big government. That money has been going into an account. And I have been doing my part. It was there. And now all these people, because they want to get into that, their salaries aren't enough. Their medical care isn't enough. Their perks aren't enough. They got their hands in my Medicare box, in all of your Social Security boxes.
And all of us who've been paying it our whole
And
life,
all of it.
probably won't get it if we're in
Right.
our 40s or 50s.
So I'm talking about things that are public and things that are private. And people like Ron Johnson comes down on the private side every time because that's how he's fed. And my word and all of our word doesn't hold up to one meeting with the Menards. You know why? Because I don't have the pockets Menard has. Don't you stand there and grin. This is not funny.
That's the truth.
Look at him and
We're
laugh.
sick of it.
Look at the veterans, these stories about veterans. I've been an anti-war activist all my life.
We're mad as hell and
But
we're not
one
taking it
thing
anymore.
I know is if somebody does go to war for this country, you take care of them.
That's
And if you pull the rug out from under them, pull their wheelchairs out from under them,
Push them off.
you don't take care of me in the next 10 years and I'm gonna need it, it ain't my country. Now that's why.
That's right. That's what we Listen.
I'm Dan Paulson, I'm on the Menomonie School Board. And I want to talk about education. There's been a lot of talk about the new education program bill. That's been, education, it looks like it's not going to be funded the way it should be funded. We're looking at, I'm hearing about cuts in a lot of areas in education. Teacher education, for one. We're looking at teacher shortages. We need all the funds available that are made possible for training teachers. We're going to get teachers who are not well-trained because of what's going on. And we need to be able to train these people and to have a world-class education. And so I would hope that Senator Johnson would resist the administration's efforts to cut back on the funding, fully fund that educational program.
We're starting to see the FY18 budgets emerge from the subcommittees. We're obviously way behind schedule. The senator is on the Senate Budget Committee. So you will all be able to see and understand his priorities even when he votes in favor of a Senate passed budget.
What about our priorities?
Well, no, it's built on education. Built on education, built on our school system, built on our colleges, and you're selling it off to the privatized world. We want our public education preserved and built on.
We all agree with it. Let's let Mr. Petri answer your question.
When the FY18 budget comes before the Senate Budget Committee, it'll include, it's a A to Z type thing, and then the appropriations bills will come forward. First of all, to your point about the administration's budget proposal, that is not being considered really at all at the Senate level. I already tell you that. The House has kind of flushed it and is doing their own thing, and the Senate will do very, very similar. It might be another month or two before those appropriations bills come forward, but Senator Johnson does not believe that the parts of the budget that need to be slashed, so to speak, like some of the Trump proposals did, education is not in that mix. So he's not. Some of the individual agency budgets that were targeted for serious, massive reductions in the Trump budget, that's not going to happen in the Senate budget that Senator Johnson supports. So teacher education, I'll make sure that is in my notes as a particular line item in the coming appropriations bill.
Steve?
Tom, thanks for coming. Steve Wagner from Eau Claire. I think there's a lot of people in this room that probably ran into a similar situation. I'm going to tell you a personal story. Just happened in the last 3 weeks, very much related to the health issue and very much related to Ron Johnson's role in this. I got a letter from my healthcare provider that I got through the open market saying that they weren't going to be able to even give us a quote on a health insurance policy this year, and they didn't really give us the reason. And I assumed if I just listened to the rhetoric that I hear in the media and on TV, that had something to do with Obamacare. So, but then I didn't want to go with just that assumption because there was no explanation in the letter. It didn't give a reason. So I called, and I called my provider, and it's Health Traditions, and they're the Mayo people in this area. I don't know about Dunn County as much, but I know in Eau Claire County, they kind of go by zip code, by which ones are available on the government website. Both my wife and I are retired. We're 62. We're counting on insurance that we can get on the individual market until we can get Medicare. And the reason I finally got, after talking to the third person at Health Traditions, because they had not given the people that you normally talk to on the phone any reasons, and so they could only speculate. And I wanted to get what the official word is from Health Traditions, and they said the instability that we are experiencing right now with Congress' lack of taking action and lack of discussion amongst the, whatever Ron wants to say about Obamacare, they cannot say, and he and his people that believe similarly cannot say there wasn't an industry-wide discussion when Obamacare was brought up and when it was discussed. And we had open forums like this throughout the country that weren't associated with groups and people, but individuals that wanted to come and talk about it. And they talked to the people that were in power. But now we don't get that opportunity. And we're not even sure that you're up to snuff on that you and your staff are up to snuff. We'd like to talk to Ron to see how up to snuff he is, right?
Yeah, that's what I want to know.
So, this directly affects me, but the last thing I want to say is the Medicaid cuts that we've been focused on a lot tonight, with the exception of Ryan over there, I think, we're really with the elderly. But I have a great niece that probably wouldn't be living today without the Medicaid assistance that she got at birth. And for the next few years, there were surgeries involved. She had young parents that couldn't afford, and she had family, and people like my wife and I that would help in ways like when she got old enough and she they couldn't watch her, all the time. They couldn't let her out the door because she'd go we helped them get a fence and things like that. How are people going to help their families if the most basic needs is, and that's what Ron said. The reason why he didn't want to vote the first time around and why they held it up and they went back into discussion with Ron said there weren't enough Medicaid cuts. You alluded to that earlier in your answer to an earlier question, that the cuts weren't firm enough, that he couldn't count on them, and they weren't fast enough. And these are the people, the most vulnerable people like that young gentleman over there that expressed so eloquently how it affected him personally, and it's affecting all of us personally because we all have people in our families like him.
Medicaid reductions is in the expansion population. That's what he's interested in rolling back in the shorter time frame. The legacy Medicaid for the elderly, the children, and the disabled, he's confident that even with the reductions and future increases that the Senate bill contains, that by returning management back to the states, ultimately.
But what about the chaos that's being created right now? So because insurance is based, they hire actuaries to figure out, so they can pay their multi-million-dollar salaries to guys that are making hundreds of thousands in stocks options all the time that are a part of the insurance company. They have to figure this out to the nickel, but they have no clue, and they got to have this figured out by they go online the end of October, I think it is when we start doing our open enrollment. Those of you that are on that are on the ACA, there's got to be more of you, but anyway. But the other thing I wanted to point out, we talked and we had an introduction by Jeff on the Wisconsin Action Group, and I apologize. You guys did a good job getting this, but there's just we're all normal, concerned citizens here. If this was Ron Johnson and it was at the country club and he invited us in, we'd be there too, right?
Sharon.
Thank you. I have a comment, actually, I'm going to be changing the topic from healthcare, but I do want to make a comment about that first. I want to actually talk about Homeland Security. You made a comment that Mr. Johnson is philosophically opposed to single payer. I would like to see him move away from that and represent, the people's view. The government does have a role. We've tried the for-profit system. We've tried employer-provided. We're probably, someone mentioned, maybe the only country in the world that does that. And it's not working. So take that back, please, to Mr. Johnson, and just please have him consider that governments should have a role in the health care of its citizens. The welfare. Second thing I wanted to bring to your attention was, right now, I think the biggest threat we've got as a country regarding, and I know that Mr. Johnson serves on, is he on the Homeland Committee? I know he's on National
He's the chairman of the Homeland Security and Government Affairs.
And I've written him, but I haven't got a comment back from him about this. The biggest threat we have in the country right now is our own president. One time, one of these fuses is going to light. It's going to happen in Turkey, it's going to happen in Syria. Russia's going to invade what used to be our allies in NATO. Lithuania, Poland, they're all vulnerable, and the Baltic states, that's just barely below simmer right now. Or Korea. We just don't know where it's going to happen. But a fuse is going to light. The man who's in the White House is incompetent and unable and unfit to handle that kind of thing. What is Senator Johnson doing on his committee right now to prepare for just such an event?
Well, he's working with people that President Trump has appointed to run. He's almost universally, he's very pleased with the people that President Trump has surrounded himself.
Oh, my land!
The leaders of General Mattis, so on and so forth, Secretary of State Tillerson, he thinks these are people that are right people, right men, right women to the right job.
You have a few names here, but how many, there are a lot of federal positions, what, 500 yet to be filled?
Oh, there's hundreds, yes.
We're very vulnerable. I want you to take that back to Senator Johnson and say, we need a contingency plan. When one of these fuses lights, we need to know that it isn't Mr. Trump making decisions.
Stand back.
We got way too many people for me to call on you again, so you don't bother. This gentleman right here. Yeah.
Did we send those sign-up sheets around?
Yeah, we still got, there's another clipboard around here. This one's full. There's a second one around here somewhere. Back there, I see it coming. Yes, sir.
Yes. My name is George Zaski. I'm over from River Falls, and I have a son with a cognitive disability. And if he were here, he could talk backwards with you, but to talk about the level of discussion about slowing the rate of growth of Medicaid in the out years. In the current environment, with the current funding structure, in 2011, Governor Walker and the legislature put caps on enrollments. My son spent 10 years on a children's waiver waiting list under the current funding. So I'm supposed to sit here and look out with the projections to 2036, when he'll be about 40 years old, and figure that there's going to be the funds there when under the current funding structure we have children's waiting lists, and the state innovated by putting caps on enrollments back in 2011, and the only reason they came off is because CMS wrote a letter to the governor and said, you're in violation, take them off. I don't have a lot of confidence that lowering the rate of growth, we call them cuts, I understand the talking point is lowering the rate of growth. We're not funding it right now. And so I'm not supposed to be worried about what his future is going to be like 20 years from now. I mean, I accept my retirement is going to be nothing like when I was 20-something and envisioning it. But I accept that. But there's a limit of what I can do or anybody else in this room can do for their loved one when they have expensive medical conditions. His medication, when it was not a generic, was $12,000 a year. So what, do I not give him medication and let him have seizures? I mean, I know you don't want that, but when you talk about what these effects, what these cuts are going to do, it's going to hit real people. And I don't know if I'm gonna be around 20 years from now. And do I have to worry? I mean, I've taken a family member or two through spousal impoverishment so that they could get Medicaid services.
You shouldn't have to marry a plastic industrialist to have
I actually worry. It's like, what do I do so I can fund as well as I can for him and not have to worry about funding for myself? And I just think it's really painful that there are going to be so many other people who are going to be in this situation. It's going to be real. I mean, TPT did a really good show on Alzheimer's. It's a 20-inch Twin Cities Public Television did a great hour-long special on Alzheimer's. That is $1 trillion problem just waiting out there. And we are not going to fund this kind of stuff because we're going to, what, our military budget is going to...
$1 trillion just last week they approved.
And our budget is spending what? We spend the same as the next 10 countries? Or 8
More than
countries,
that.
depending on-
This lady right back here, and then this gentleman back here, not you, Mike, the guy behind you.
Thank you for calling me. Thank you, Mr. Petri, for being here and taking all of our comments. And I thank everybody for your eloquence. I am so inspired. I'm going to take it back to the healthcare. I'm 59. I try and survive on less than $15,000 a year income. I work. I am farther than you are from Medicare, and I hope Medicare is going to be there for me when I get there. In the meantime, I have been so fortunate to be able to purchase an individual policy on the exchange, on the Obamacare exchange, and it has meant the world to me because I can go and get a checkup that doesn't cost me more than I can afford otherwise. I need that. I just got a similar letter from HDHP, my provider, my insurer. So I have to go shopping again. I don't know what I'm going to find. There's enough uncertainty in the market for me as a consumer of healthcare and for me as a consumer of health insurance. I'm sorry, I have to purchase health insurance in order to get healthcare. I should just be able to go to the healthcare store and buy healthcare, right? It would be so nice. But that's not the way it works in our country at this point. I would so appreciate Senator Johnson's attention to people who are working, poor, struggling, proud, smart, and are looking for some support and some assistance in getting their basic healthcare needs met. I hear a lot of fear here, I hear a lot of uncertainty, and I don't think we as American people should have to live like that. And I really appeal to Senator Johnson to stand by us and work for us, his constituents. Thank you.
Marty here.
Right. My name is Adam Woodward, and I'm from Fall Creek, Wisconsin, County of Eau Claire, little bitty town.
Real loud, please.
All right, I'm from Fall Creek, Wisconsin, little town out of Eau Claire. And I'm a veteran. I'm a retired cop. I retired early to take care of my youngest son, who is autistic. All right, we've been taking care of him for many years. First thing I'd like to ask you is, sir, do you know if one of your talking points that we hear, Obamacare is failing, everything is failing, it's imploding, it's this, it's that. Okay, but isn't it a fact that a lot of the insurance companies are dropping out of the exchange and raising their rates because the federal government isn't paying the subsidies that they're supposed to these insurance companies?
That's one of the reasons why.
That's right, and why aren't they doing this? So it looks good for you guys to say that, oh, it's failing, it's good.
That's spiral. You're specifically referring to the cost-sharing reduction payments that the insurance companies have that are offering plans.
Whatever, they're supposed to be paying money by you guys.
There's a whole bunch of money that...
Why? Why aren't they being paid?
Right now, if you ask Senator Johnson, he'd say we have to come up with, I think the number is $30–40 billion to strengthen those markets to make sure that
take it out of defense spending.
we're here. But you know, there was a lawsuit filed several years ago, and it's meandered its way through the courts, and you've all heard President Trump threaten not to come forward with those.
Why doesn't somebody tell us that it's failing?
Senator Johnson's been talking for months about the need to do that, to shore up the markets. so that individual insurance companies can't pull out and stop offering plans and then saying, well, we have to stop, like I think your letter basically stated, we have to stop because of the uncertainty, and because then it becomes, we know instead of we're not sure if we offer this plan if we'll lose money, we know we're going to lose money, we're not willing to do it, and so we're going to not offer plans. And so it comes down to that.
Here's one other
Because it is about money and debts.
Okay, here's one other thing I want to bring up.
That point.
You're treating the symptoms and not the cause with your attack on healthcare. Look at the hospitals, look at doctors, look at what's going on. I'll give you an example. All right, I have to get a monthly blood test, all right, monthly blood test for an INR. I have to go in, first I have to pay, my insurance company pays $100 a month to belong to this coagulation clinic. And then, for me. And then I go in to get this test, and they pay $130 for this test. And then, they don't pay $130, I usually do because it's my deductible. Okay, and then what they do is they look at a little list that says, oh, you're 2 points down, you have to take one more pill, or they say you're 1 point down, or whatever, and they tell me how many pills to take. I went to a lab place here in Eau Claire. Do you know how much it costs for them to do the same test? $29.95 to do the same test, and no $100 a month. But when I do that, my doctor won't accept that test because it isn't done in the hospital that he gets paid by the insurance company for.
Ridiculous.
That's right, and if you ask your doctor for all the other tests that you get, like your blood work for a physical, do you know how much your insurance company is paying for that and how much you got to pay for your deductible? If you go to this private lab, it's 1/3. But your doctor will not accept those tests because you are not going through their hospital.
That we run into that argument with from veterans a lot of times when they're talking about where they can get certain services and they have to go to the VA.
That's right. That's baloney. That's baloney. Now, the one more statement and then I'm done. Okay? I could go on, but leave me for a long time.
No, your wife won't let you.
No, I don't. She's pulling me again. Just shut my mouth. But I was at a meeting a while ago and I heard a man make a statement. And I think this statement just fits me and it fits everybody here. Okay, the biggest threat to my family, and I think everybody in this room, is not terrorism or immigrants, it is my government.
And then I think John Finley.
My name's Martin Voss. I'm a retired physician. I should be talking about medical issues, but they've been so well brought up. What are the issues? One thing that might have been an omission is I'm perplexed with why Senator Johnson is not supporting more Medicaid involvement and funding in this state rather than his position of backing it off when already Wisconsin's been screwed by Walker with not being involved with the Medicaid funding. We're already penalized. So where is that? The other thing, the only town hall meeting that he was at that we could get into was over at the mosque in Eau Claire. And what was brought up there, and I've seen absolutely nothing about this, the person that is the leader of the mosque brought up the issue at another physician. There's a tremendous provider shortage in this state. And the bill that's presented with primary care, if you look in a huge section of northwestern Wisconsin and other areas, that primary care is being provided by Planned Parenthood. And their funding, part of this bill is completely cutting Planned Parenthood. What if he does that? If he votes for that, who's going to step in and take that place? We don't have providers. I graduated from medical school over 40 years ago. We're not turning out any more doctors than we did back then. What's the population done in that time? It's gone up.
100 million.
You know, what is the solution to that? We're not getting any help on this. And especially knowing the position of the governor, I would think he'd be doing something to help the citizens of Wisconsin by increasing the federal funding that we get. Instead, he's talking about rolling it back. It's not severe enough. I can't vote for it because it's not severe enough. But that's not why I stood up to talk. It should kind of piss me off standing there. What I want to talk about is Russia and the Homeland Security thing.
Yes.
I've talked to his office about this directly, and the feedback we get is that all the talking is about leaks and leaks. If there weren't leaks, we wouldn't know what's been going on. And why doesn't he support the investigations to really get to the bottom of this?
And many others on both sides of the aisle feel that, yes, there needs to be something done.
Good.
in
I
that.
know Tammy Baldwin is concerned about it.
She's one.
Yeah, and so.
And let's hope it's bipartisan when it happens. I know President Trump, for all of the issues people here have with him, that was something he is very committed to. At least that's what he says.
What has the senator done to reach across the aisle to meet with Democrats? That's something that's just astounding to me, sir.
This woman right here, and then Lorraine back there.
Well, I'm Kathy Roberts, and I keep coming up with more questions. I live in Hudson. I'm part of the Indivisible group. I understand, and maybe the gentleman that just spoke, that's a retired physician, that the AMA, the American Medical Association, came out against this bill.
Yes.
So if the people that are working in the trenches and helping people, if this group is against them, this bill, then why are we even talking about it? And the other thing that really upsets me is that this was done in closed door session with just a few Republicans. Whereas the Affordable Care Act, which I prefer to call it, was done on a more open basis and more bipartisan. And the other thing is, we have some teenagers. There's a lot of anxiety out there, and I attribute it to all of this fake news that's being talked about, and the stress of our education system with all the hand down from the No Child Left Behind. But a very well-known psychologist said that never before, and this was at a public forum at a church in Hudson, never before have these young people that have anxiety and stress disorders, have they had the coverage that they have gotten under the Affordable Care Act. And I, as a grandparent, am very concerned about that because there is a lot of stress out there. These kids are, and I attribute it to some social media issues, and I attribute it to a lot of different things, but I am appalled at what I hear coming out of President Trump's mouth. It makes me sick. And as my brother-in-law said, who lives in Maryland, he said, what bad thing is going to happen today? And that's kind of how I feel. And the other thing that I wanted to say is that I want to ask you, I have tried to keep track of Johnson's voting record, but it's a little hard when you're in Hudson because you don't get the Eau Claire news and you only get the cities. And I know how Al Franken and Amy have voted, and I've met both of them, and Tammy has come to Hudson. But I want to know how he voted on Jeff Sessions, which is in this Russian loop.
He supported.
Right, he supported him. He supported Betsy DeVos, who paid her way, has no public education background at all. And I'm a retired teacher, and it just is appalling that she is supporting the voucher system, taking money out of public education. And also some other thing, I don't know, cutting in funding for programs for health education, I think. So, and then I feel like the Republicans have been the obstruction because even President Trump said one day that Mitch McConnell has done a really good job of dragging his feet on nominations that were proposed in the Obama administration. According, of course, they never got around to the Supreme Court. And so when President Trump says that Mitch McConnell did a really good job of dragging his feet, I'm thinking, what are we doing? I mean, it sickens me.
It's not, it's far, far from ideal, and in both parties.
You know what?
No,
wait a minute. You cannot say that. You cannot.
What I'm saying is that
just let me finish my statement. I'm just saying that there is so much control over whoever is in leadership. And maybe Mr. Reid, Senator Reid did the same thing, I don't know. But when President Trump said that Mitch McConnell did a really good job of dragging his feet because they've had the Senate and the House for the last years. And then you see on TV, they go have a celebration of beer at the White House for passing the House bill. I mean, it makes you sick.
Our lives.
I'm just appalled. And that's all I can say.
Joe Ryan is heartless.
Well,
Mitch McConnell is a colluder too, because Obama brought him the Russian evidence and he wouldn't bring it to the floor of the Senate to say, we need to do something. McConnell colluded as well.
All right, Doreen, there, and then that gentleman leaning on the wall there. Yeah.
I am William Vetter. I'm a retired physician and I'm from Menomonie. And I want to understand our senator better, Ron Johnson. My question is, does Senator Johnson believe that health care is a human right? Mr. Petri?
Oh, okay, I didn't know. Does he, I think he feels that that everybody has the right to quality care. Yeah, everybody has the right to be seen and be treated and be taken care of by a medical provider.
Really good. That's really good that he believes we all should have it. And how does he feel about the right to life?
Very strongly support right to life and the issues that surround
Right to birth.
abortion.
Right to birth. Who has the right to life? Who has the right to life?
Everybody.
Everybody. Thank you very much. We could save $400 billion a year if we had single-payer health insurance. And I know that Ron Johnson likes to bring down our problem with our deficit, and he likes to make profit for businesses. So I would really want him to strongly encourage single-payer because it would help a lot of people get health insurance. And it would help a lot of businesses so that they wouldn't be penalized by having to buy very expensive insurance policies. Thank you very much for being here.
Thank you.
I'm Gene Holt. I'm 66. I wasn't able to afford health insurance until Obamacare came around because of chronic condition, Crohn's disease. And so it was helpful for me. I'm now on Medicaid, or Medicare, not Medicaid. I do not believe either of those programs should be cut. I really thank you for being here. Those needs are going to grow as our population ages. I am opposed to giving health cuts, cuts to the rich people in order to have funding for the military and cutting the Medicaid and Medicare. And I think that this is a very bad health care plan because it covers lots less than Obamacare or Affordable Care Plan did, and will throw a lot of people out of insurance or make it unaffordable or give them coverage that really doesn't cover anything. And so I think the majority of Ron's constituents are against this bill, and we would encourage him to not support it. Thank you very much.
We deserve better.
I'm Margaret Hagelin from Menomonie, and I think we need to take the politics out of this whole discussion, and instead of calling it Obamacare, let's call it the Affordable Care Act, and let's figure out how Republicans and Democrats can fix our healthcare system instead of battle between each other. Instead of looking at what they can get rid of, let's look at what we can do. And I think it's unconscionable that the United States, which is the wealthiest country in the world, does not have health care for everyone. And I think that Congress needs to be working toward how do we do this, not how do we stab the other person in the back or how do we fight each other. One of the things that we've had a number of people have mentioned things about the hospitals, about the doctors, about the medical community, the pharmacies, and And I just want to bring up a quick example. We were charged $75.50 for 2 pills for day surgery. That should have cost $6.25. And it's because the hospital can charge whatever they please. So the fact is, we need to come up with a way of getting controls over all the private businesses that are making money. And the issue of not-for-profit, several people have brought that up. Other countries, when we've traveled in other places and we've talked about our healthcare system, they can't believe that we don't have something. But one of the things is not-for-profit. All the insurance companies that are out there have to be not-for-profit. Well, we have allowed businesses and for-profit to run this country. And we need to get away from that and make it so that we provide the services to the people, not the services to the companies and the wealthy.
I'm Mike Lindsay. I've come over here from Eau Claire because this is as close as I've been able to get to a meeting, even with you as a surrogate, which I appreciate, by the way, to Ron Johnson. I don't get invited to those country clubs. I'm either a pariah or an untouchable or maybe Groucho Marx syndrome, for those who remember that one. I wanted to not refer to my own situation, other than you're saying that Senator Johnson wanted to know individual stories.
Yes.
I've had cancer twice, but that's all I want to say about it, because it's really not about me here. I'm really concerned about all the people who are much more jeopardized than I am. And I'm talking about the people who will be victimized by this health care bill, so-called health care. I'm talking about women, there's half of our population right there, the elderly, children, and about what's left would be middle-class white males, I suppose. It really is not about health care. This is not about health insurance either. In fact, it's about wealth care. I've brought for you a diagram that will help you to understand how easy it is to get from health care to wealth care. You can share that with Senator Johnson. In terms of the people who are being jeopardized by this particular bill, I'm concerned about Senator Johnson's values and what he is doing with values. He is not representing his constituents. He doesn't come to meet with them, even when colleagues of his will go and meet face-to-face with their constituents. Senator Johnson simply doesn't do that. He also is representing other than his constituents. He's not representing the women. He's not representing the elderly. He's not representing the children when he takes from those who do not have and gives to those who do have. This reverse Robin Hood situation. So I'd like to know from your behalf, in those sessions you do get to have with him, I'm just amazed that they're infrequent, as you said, what human values does he have that would suggest that Ron Johnson really cares about the people of Wisconsin and the people of our nation rather than his political party?
Question?
That was a question, yes.
Well, you've read his comments, you've seen him sporadically on TV or heard him on the radio. You know that this issue is not just a vote. It's not just what's in front of him right now. This is something that he has taken very seriously from day one. This was a topic obviously during the last year's campaign, and even as far back as a year ago, he was talking about how incredibly personal healthcare is for people, how big a part of the economy it is. He is so frustrated by the process, feeling like even though he's a United States Senator, one of just 100 and one of just 52 Republicans, he himself hasn't had as much input and ability to impact decision making as he would like. So he feels somewhat neutered, and he's obviously the senator, the senior senator from Wisconsin. So it's frustrating to him how things have gone, some political decisions that have been made by leadership, the process that's been put forth. He would not have done it or brought it forward the way it's being brought forward. He's talked at length about how we can't pass a bill, and I think the words that he chooses to use quite a bit are pull the rug out from those of you like this gentleman and that gentleman back there, or that young lady back there who are 55, 60, 62, 64, who are bumping up on Medicare age, have, like somebody said, everybody has a pre-existing condition, you're much more apt to have it at that age. Those are people he's seriously trying to make sure have protection, have the ability through, if the Senate bill was to become law, to have the ability to afford plans that they can then use. Okay, not just have a plan that they can't use. So it is something that he is dealing with every day internally. So you talk about his values, where his heart is. He's not worried about insurance company profits. He's not worried about doctor reimbursements. That's not where his mind is. He's trying to figure out how the Senate can pass a bill to improve. Okay, not necessarily to repeal, because I think we're beyond that. He's talked about that for 2 or 3 years now, that Republicans could not just repeal Obamacare and put something else, or the Affordable Care Act, and put something else in. So he's all about trying to repair it and take incremental steps in the right direction to improve the entire healthcare delivery system. And that's something that he's finding incredibly frustrating, but that's why he's sticking himself in the middle of everything. He joined that working group, though he wasn't originally invited to be a part of it. He's going in front of the cameras and the microphones every day to tell people what he thinks. He's talking to Mitch McConnell and John Cornyn and all of his members, Paul Ryan. He's trying to let people know his opinions about the bill. Now, that doesn't mean he's going to vote yes, it doesn't mean he's going to vote no, but it's something that he's taking so incredibly personal and serious because he is trying to represent it.
So if he does talk to all those other people, why the hell doesn't he talk to us?
Yeah. He's talking to you. He's not doing it in a forum that you desire.
We don't
he's
want
talking.
his colleagues do. Why doesn't he?
There's a lot of senators who are doing town halls in public venues.
Ron Fine does, and he faces hostile
Tammy Ball
Barb, and then this gentleman here, and I know you, I'm sorry, John.
I'm Barb Wise, I'm from Chippewa Falls. I've worked in healthcare for almost 50 years, 43 years as a physical therapist, recently retiring. I had a sister that reminded me of the fellow here that was eloquent about his thing. She had an associate degree in accounting and worked for years until the company got sold in Washington County, a conservative county in the state, because he didn't care for her speech impediment. She was excellent at what she did. I won't say a lot more about single payer, but what I presented to Senator Johnson as a conservative principle, and I believe you said that he's ideologically opposed to single payer, so I get it, you know, socialism, burning, all that fun stuff. It's extremely efficient. It costs what we do with far more potential and far more capacity, far better educated physicians all the way down to nurses, aides, everywhere. Our outcomes are rotten. They compare poorly on infant mortality, on the whole gamut of things, maternal health. There's no time for women and children, and these pro-life senators, I'm really impressed. It's human nature. It's human nature to be healthy, to drink clean water, to breathe clean air, to take care of our planet. This is sort of, I mean, that's the universal thing. People want to be educated, they want to learn things, they are hungry for education. What Ron Johnson says and what his votes are, it's in many cases, it's more not what he says, but what he doesn't say, what he does not speak up about if he cares, if he's ideologically opposed to something that is efficient from a financial standpoint, that covers people cradle to grave, and he calls himself pro-life, and supports people who don't give a rat's body part about, I'm sorry, but about the air and the planet and the whatever, the environmentalists and whatever, those things, and the security, and more, like this woman said about young people, anybody in psychiatry and psychology will tell you how stressed young people are, and there's no way it's not killing off a bunch of us old people. Bringing all those things together, those things I would like to have Ron Johnson take a look at, because people who are healthy and educated want to work, they want to contribute, and it's like Paul Wellstone said, when we all do better, we all do better. And Ron Johnson doesn't seem to get it, and I'm sorry he doesn't.
Hi, my name is John C. I'm a retired teacher. I've had a number of issues I'd like to respond to here, but I know our time's running short, so I'm going to cut it down. Mainly, I'm going to talk about the credibility of comments coming out of the different political stations. I think with, as far as Johnson's concerned, he's totally lost it as far as I'm concerned. I simply do not take anything he says seriously. That's where I'm at right now. And I'd like to kind of mention a little, there's a precursor to this attitude I got. About a year ago, he was talking to a group, I think it was in Barron County, it was a luncheon group, and he was talking to this group, and he expressed the fact that, in his opinion, he was a conservationist. Well, I don't remember much of a audience reaction, but I took the trouble of looking at the League of Conservation Voters' voting record, and it turns out he's got a 6% favorability rating as far as the environment's concerned. That's a little bit of a stretch from being a conservationist to having just a 6%. That's rock bottom. That means this guy sees the environment as something to exploit. That's where he's coming from. Now, I think that same kind of talk on his part, I don't know if you call it just careless talk or if he's delusional or what's going on, but that gets him in trouble. And I think we see it in what's happened just recently, this last week, in terms of his statement how he was opposed to the Trump care vote, or he had concerns about it. Well, at first, a lot of us on the far left were saying, whoa, you know, maybe the guy's going to change your heart. This is interesting. Let's keep our eye on this. Well, a guy named Dave Ziefeld, he's the emeritus editor of the Cap Times.
Dave's wife.
Here's what he said about that little misunderstanding. He said, it became clear as the week wore on, our millionaire U.S. Senator is opposed to the Senate's bill, not because it would throw 22 million Americans off health coverage or push poor kids and elderly folks in nursing homes off of their Medicaid, but because, frankly, it isn't mean enough. And I guess I take that to heart. That sounds to me like a very legitimate explanation of what's going on, and I think that's where the two political parties are.
Hear, hear.
Hi, Wendy Dart from Maiden Rock, Wisconsin. I'm a retired nurse, 42 years, mostly in Marshfield, Wisconsin. I think we're talking about two different things. We're talking about public and private. Private needs to have a profit center. And so when you have things that are private, you have to look for that profit center. And it doesn't mean that you're actually saving money. In Marshfield, we were part of the CMS demonstration project. And we saved bazillions of dollars by giving more care, by following up on the phone, by giving a more complete care and giving someone to talk to 24 hours a day. We saved more money than you can possibly imagine. The other thing is, I tried to talk to Senator Johnson before. My husband is a retired physician as well. And we're very willing to pay our taxes, by the way. Our son had non-Hodgkin's lymphoma. The first flush of treatment did not work. The second treatment is absolutely terrifyingly awesome. But he was able to get an autologous stem cell transplant. So that is that you get your own stem cells back, right? Now, this was developed through NIH money. So I'm leading to the budget here. NIH money. That's all of us gave with our taxes money, and the NIH then gives that out to other people around the country doing research, correct?
Yep.
That happened to be at the University of Minnesota that they developed that, but it's used all over. It was a horrible treatment, but he survived. Now, private corporations, big pharma, I don't care what they say they're using their money for. If you need that profit center, there's no way you're going to have enough money to do the research to develop something like autologous stem cell transplants. So our argument is between those two things. And health care, we're talking about insurance. Health care is not like selling pencils or polka dot dresses. Delivering health care is something else entirely. So I would like you to repeat that to him. Thank you.
Any of my letters he has not answered, my phone calls, the mailbox is full. I have not gotten answers to my emails. So I hesitate to say he is listening and that he cares.
We're doing our best to reply to phone calls and emails. We are swamped, as you can imagine.
We're gonna run out of time.
We're swamped.
Ruth over here.
Thanks for being here, I echo that. My name is Ruth Oddix, and the uncertainty of what's going on right now, we really do need bipartisanship. That is so important. And what's happening right now is creating so much instability. We should take the ACA where it's at, we should make it better, not turn healthcare on its head. I have a daughter who has special needs. She was born, or at the point of her birth, there was a prolapse cord. And there weren't medical people in the room. At the time, we were left alone, and we didn't know what it was. So, I always have trouble with this. I don't intend to, but I always do. She went through a series of strokes at birth. And the medical staff, when they saw it, they came in and they had to decide what to do. And she was able to be delivered vaginally and not a C-section. But she's born with a number of pre-existing conditions. So she's a very demanding child. She's 36, almost 37, but she's also a very delightful young woman. I enjoy her so much and her perspective. I think if she were in the room, she would bring this conversation to the right place. Things are pretty clear for her in life about what's important and who's important, which is everybody. And she requires 24/7 care. She receives Medicaid to pay for goods and services she needs. This is not money just given to her. This is money that's approved. These are approved goods and services and medical care. We can't just go throw money to the wind. We have to have all these checks and balances about what money is spent for, which I am good with. And she's got a care provider with her right now so that my husband and I can be here or maybe go out for dinner or that I could consider a job outside the home. The cost of one prescription, she only needs one major prescription for her seizures, and that's $800 a month. She can't afford that. We could not afford that. And that's a small amount of money compared to what other people are talking about in this room and what other people experience in this room. I know that. But we can't afford that. And so her Medicaid, or just to tell you that Medicaid has increased in cost much lower than general health care. Medicaid is very efficient. It pays for 20 programs in the state of Wisconsin, most of which are optional programs. And the bills that are going through will make that easy for states to say, no, not going to do that, not going to do this. We're talking about things like IRIS, family care, Katie Beckett, school-based services, birth to 3, family care, forward health care, the list goes on. The people who get Medicaid in this state are primarily people with disabilities, elders, children. I think 40% of those who get Medicaid in the state are in fact children. So Medicaid also is not a zero-sum game. It's not like it just goes to individuals and then that's it. It is so much more than that. It pays for these goods and services in medical care, which are jobs in our state. And there's probably any number of people in this room and family members of people in this room whose jobs are paid for. So you could drive Abivan, a transport service. Every time you see a transport service, that's Medicaid dollars. Every time you see special services in schools, that's often Medicaid dollars. When you see somebody out in the community and they have somebody with them, that might be Medicaid dollars that allow them to get out into the community or put socks on their feet when they wake up in the morning or help them take a shower in the morning. These are all essential services that allow people to live a life of respect, a life of being able to do more of what they want to do and not be left at home. And it can mean jobs for people with disabilities as well. So to me, this is the best of what tax dollars can do. This is federal and state money that comes right back to our own communities. A lot of the people who get paid with Medicaid dollars aren't making big salaries. They're paying their mortgages, they're paying their rent, they're going to the grocery store, whatever it is that keeps life going and keeps our communities going. Those dollars change hands all the time in our communities. So it's a big deal when we start talking about cutting these services. And although I hear Senator Johnson say that children, adults, people with disability, who really were the intended, from his words, people to get Medicaid, and I don't think that they should be the only one. I'm not only here because I care about my kid. But these dollars, then when it comes back to the state making decisions, he has no control with what the state's going to decide to do.
That's up to the governor and the legislature.
That's up to the governor and the legislature. And so I'm not necessarily comforted to say, well, that, this will not happen.
A lot of people want the federal government to remain in control of the Medicaid program, and then the states have to apply for waivers to get permission to try things innovative or whatnot. And others want the decision-making given back to the states.
And the states have a lot of flexibility in decision-making as it is. We have gone through a renaissance in the state with IRIS and family care. We have really cut those costs. We have provided in-home care. It is really the best. And we will be hurt more because we did that. We will be hurt more by what they're talking about with the caps.
People with the seizure disorder are the same in Wisconsin as they are in Minnesota. It makes no matter where you live.
Or Mississippi.
It is a seizure disorder.
So what I just want to say, I know that Senator Johnson has said, because it's in his op-ed in the New York Times, that patients neither know or care about their health care costs. And I think we don't know, but I do think we care about them. I think there's a lot, we get bills and it's mysterious, why things are costing. Right, exactly. And so I do think that people care. And I would like to ask that no health care bill would be passed. I'd like Senator Johnson to he said himself that he wants his constituents to know more about what's going on. He wants to know more, he wants his constituents to know more. No health care bill should be passed until the legislators themselves can explain it to us, can tell us in their own words what is going on here, and explain it in a way that they vet this with the public. So, thank you again for being here.
We may have run out of time. That was very well.
Some of you stay and help stack chairs.
Yes. Steve can't do it alone.
I don't want to.